Hello, my name is Ali Haider, and today's date is October 3rd, 2022, and I will be answering the questions for case assignments number 2, the video assignment, and I will be answering questions for case number 2 and case number 4. Alright. Case connection unit 2, case number 2. A 16-year-old female is recently diagnosed with the deficiency of muscle glycogen phosphorylase. She and her family are concerned and ask the following questions. Based on what you know about skeletal muscle glycogenolysis and muscle metabolism, please respond to each question with a thoughtful answer that describes the metabolism in these various scenarios in language that your patient will understand. I'm not sure I understand the issue. Can you explain how muscle glycogen is used normally during exercise? When you start exercising or doing any kind of physical activity, you eventually get tired, right? The muscle glycogen in your body breaks down into energy, and this is the same energy that your muscles use in order to move. As you continue to exercise, your body starts running out of muscle glycogens that are used to make you more energetic. This is why you might get tired or hungry afterwards. In your situation, it is a little tricky. Normally, the body produces a molecule known as glycogen phosphorylase. This molecule is the reason we are able to move our bodies. This is because it is the one that breaks down the glycogen into the energy that we need. In rare occasions, such as yours, the body does not have or cannot make the needed amount of glycogen phosphorylase. As a result, you might see that you get tired a lot quicker than maybe some other people. I really like to take long walks. Will I still be able to do this with my friends? Although I recommend people to walk as a means to maintain their health, I would not recommend that you partake in long walks frequently. This is because if you push yourself too much for too long, it can have some really nasty consequences. Some of this stuff includes injury, headaches, and digestive problems. Especially in your situation, your body cannot get energy as efficiently due to the lack of muscle glycogen phosphorylase. I completely understand your concerns and feelings, so if you occasionally end up going on those long walks, just make sure to take a few breaks as needed. This is so you can at least give your body some time to rest in between your walks. As a result of this deficiency, will I need to get up at night to eat to maintain my blood glucose levels? Actually, you don't have to worry about your blood glucose levels. There are muscle glycogen phosphorylases and liver glycogen phosphorylases. These are actually two different molecules. The glycogen phosphorylase in your liver is completely normal, and it is used to maintain your blood glucose levels. The liver glycogen phosphorylase breaks down glycogen to make those glucose or sugar molecules and make sure that your blood sugar levels are normal. Although those same sugar molecules are used to make sure your other body parts are healthy. Also, those same glucose or sugar molecules are used to make sure that your other body parts are healthy. This includes stuff like your heart, kidneys, eyesight, nerves, and such. Do I need to worry about producing excessive lactate during intense anaerobic exercise? I will not try to perform intense exercises, especially intense anaerobic exercises. Anaerobic exercises are intense physical activities that do not use oxygen. Instead of making those energy molecules from glucose, your body makes lactate. As we all know, too much of anything might not be good for us. When your body starts making too much lactate, it can cause a variety of health concerns, including abnormal heartbeats, hard time breathing, and inflammation of your pancreas, and stuff like that. Case number 4. A previously healthy 2-month-old female presents with jittery spells several hours after breastfeeding. Her mother reports that she has not given the baby anything to eat other than breast milk since birth. The baby has only recently been sleeping for more than 2 hours between feedings, and that's when the mother reports these symptoms started. Laboratory results are consistent with hypoglycemia, low blood glucose, but are otherwise unremarkable. Epinephrine is administered, and there is no increase in blood glucose, but there is an increase in blood lactate. Physical exams reveal a liver edge 4 cm below the right costal margin. Percussion of the right chest and abdomen confirms hepatomegaly and large liver. Blood glucose levels increase after breastfeeding, but she cannot maintain blood glucose levels within a normal range during fasting. Based on the information above, which of the following is most likely the diagnosis of this patient? The most likely diagnosis of this patient is actually glycogen storage disease, in my opinion. This is because epinephrine injection was administered, but there was no change in blood glucose concentrations. The blood lactate concentration increased upon injection, however. This leads me to believe that the diagnosis for this patient is glycogen storage disease. Glycogen storage disease is a hereditary disease in which the body lacks one of the enzymes essential to glycogen breakdown. This can cause a variety of health concerns, as the glycogen will start to build up and damage several components of the body. One of the major symptoms of glycogen storage disease is an enlarged liver. The patient's test results line up with hypoglycemia. This means that the patient's body is unable to break down glycogen molecules and lacks one of the enzymes responsible for breaking down glycogen. Furthermore, epinephrine injection did not change blood glucose concentrations and supports the evidence in which the patient's body is unable to utilize glycogen molecules. Epinephrine is a hormone that activates glycogen breakdown in the liver, which synthesizes glucose molecules used in glycolysis. In glycogen storage disease, there is usually a lack or impairment of glucose 6-phosphatase. Glucose 6-phosphatase is the enzyme responsible for breaking glycogen into glucose. The absence of this enzyme results in low glucose concentrations and an increase in lactate fermentation. Additionally, the patient's blood glucose levels increase just after breastfeeding, yet they are unable to maintain blood glucose levels during fasting. Normally, when our bodies are in the fasting state, we use up our reserved glycogen molecules for our body. However, this patient is presented in a case in which blood glucose levels are not within the standard range during fasting. Although there is not any information discussing whether the patient's blood glucose levels were either above or below the normal range during fasting. Hereditary fructose intolerance is a rare genetic disease in which an individual cannot catalyze fructose into glucose due to the lack of the enzyme aldolase B. In such cases, individuals are likely diagnosed with hypoglycemia as well. Fructose is first converted into glycogen in the liver. However, the inability to convert fructose into glycogen would not signify the proper diagnosis for this patient. This is because the results state that the patient is unable to maintain normal glucose levels during the fasting state after just receiving breast milk prior. Glycogen should still effectively break down to regulate blood glucose levels. Unfortunately, this diagnosis does not match with the provided test results. Galactosemia is a rare genetic disease that inhibits an individual's ability to convert galactose into glucose in the liver. Individuals that are galactosemic lack the enzyme galactose 1-phosphate uridyl transferase. This enzyme is key in converting galactose into glucose. Common symptoms of galactosemia include enlarged liver, jaundice, vomiting, and diarrhea. This patient could be diagnosed with galactosemia, but further testing may be needed to confirm this diagnostic. Glucose 6-phosphate dehydrogenase deficiency is a genetic abnormality that creates an absence or lack of glucose 6-phosphate dehydrogenase. Glucose 6-phosphate dehydrogenase is the first enzyme that is needed in the pentose phosphate pathway to synthesize ribose 5-phosphate and NADPH. Glucose 6-phosphate dehydrogenase deficiency causes hemolytic anemia, which is destruction and lack of red blood cells. This is because glucose 6-phosphate dehydrogenase also protects the red blood cells from being destroyed. This patient's test results do not indicate signs of hemolytic anemia. Additional symptoms include fatigue, abnormal pale skin, jaundice or yellow skin, and enlarged spleen. These symptoms do not match the description of this patient's symptoms. Thank you very much.